Hello, good afternoon. My name is Yamile Armas and I'm a respiratory therapist at Miami-Dade Medical Campus in Miami-Dade College.
Hello, my name is Barbara Noguerol. I am a respiratory therapist student in the medical campus of Miami-Dade College. The procedure that we want to explain today is called endotracheal intubation.
The indications are hypoxemia, hypercarbia, relieve airway obstruction, facilitate secretions clearance, respiratory distress, apnea, and protect lower airways.
The contraindications for this procedure is patients decided not to be resuscitated, clearly expressed and documented in medical record on an illegal document, DNR and DNI.
And the hazards are post-extubation mucosal edema, trauma, aspiration, bleeding, infection, and tube problems such as pilot tubing, kicking, or disinflating of the cuff.
Now that we are already explained the contraindications as indications for this procedure, the first thing that we're gonna do is wash your hand for 15 seconds and put the gloves on.
The next thing is here's our patient. We have it already assessed, and he's being directed to be intubated because he has a obstruction in the airway. Now the next thing is gonna put him in sniffing position. Okay.
Okay, we're gonna reoxygenate our patient with the MVP bag that is already inflated. So we're gonna reoxygenate our patient for 30 seconds. Now that our patient is already pre-oxygenated,
We're gonna test now that we're gonna tell you what's ready for the intubations, the equipment we need.
we're gonna use a laryngoscope, lubricant for the ETT, a capnographer. We're gonna use an styler, pre-ensemble ties. We're gonna use an scissor, 3 different sizes of ET2, and a young cover because if it's needed a suction operation. We're gonna also use a 10cc syringe.
Now we're gonna check the ET2. Can you hand me the ET2? Thank you. We're gonna test. So here is the cuff part, and here's the pilot. We're gonna try to inflate before introducing it to the patient to make sure it inflates correctly. There is no leaks on the pilot or in the ET2. If you could see, there is inflated. I can take it out because it have to be sterile before we put it into the patient.
We also wanna use a thermometer for check the cuff pressure.
Yeah, after we insert the tube. Now, I'm gonna disinflate the cuff. We're gonna pre-oxygenate again because we introduced all the equipment. This is done for 30 seconds. Now that we have tested this, I need the stylet. The stylet is to put it inside the tube, the ET tube, so I could design and give it some rigidness while I'm introducing it into the patient. Okay. And we're gonna proceed to put some lubricant so it will be better inserted.
We're gonna lubricate the ET2 to avoid trauma in the tissue.
Can I have the laryngoscope, please? The laryngoscope, as it's open, it has a light, so it could help us guide and see where the trachea is to insert the ET2. This is a sleeping position, the patient. I'm going to insert the laryngoscope with a Miller blade pointing forward and up.
Without put pressure in the teeth. We have to make sure that the ET2 goes into the right place through the vocal cords.
It's okay. 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 Now it's inserted. We're pulling the stylet out and inflate. Can I have this? Inflate the cuff and pilot. Well, before we do that, let me check if it's in the right place, okay? Can I have the MBB back? And we're gonna put the capnometer to test if it's in the right place and not in the stomach and if it's the lung. This will detect the CO2 coming out from the lung. Go ahead. Yes, it's in the right place. Now that we know it's in the right place, I'm gonna go ahead and inflate the cuff and the pilot tube. Checking there is no leaks. And now we're gonna proceed to put the tide on. Okay? Can I have the tide? We twist it on this side. This and hold it too. Now that I'm putting the tie, it's been tied, we check that it's in place, it's not coming out. We'll oxygenate the patient again. And now with the mammographer, we're gonna check the pressure and that is within 20 to 30. See, it's correct. It has a nice pressure. Now we have our patient intubated. Thank you very much. My name is Yamile Armas, and I'm from Miami-Dade Medical.
My name is Barbara Noguerol. I am a respiratory therapist student at Miami-Dade College. Thank you for your attention.